Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Maungwa is with me on the sign language desk. In today's update, I would like to focus on COVID-19 treatment and clarify a number of issues that have come up during the past 2 weeks, especially on the use of ivermectin drug. But first, let me walk you through the most recent COVID-19 statistics. This week, the highest number of cases was recorded in the Americas and European regions. South Africa continued to account for the highest number of recorded new cases in the Africa region. As of Thursday, 28 January 2021, Zimbabwe's cumulative number of COVID-19 cases was over 32,300, with over 23,600 recoveries, 1,122 deaths, and a recovery rate of about 73%. Harare and Bulawayo metropolitan provinces continue to be the nation's two big hot spots. Note, however, that the provinces in the southern part of the country, such as the Bulawayo metropolitan province itself, seem to be on a recovery path with their recorded new cases per week steadily going down. The country's epidemic curve is showing that the second wave is beginning to level off, we think. This is an indication that the country's response is getting back on track. Implementation of the nation's surge-specific strategies and activities that I talked about at the start of January this year, that is at the beginning of the second stringent lockdown, are beginning to show some results. The country is, however, not out of the woods yet. We must remain focused and continue to strengthen our response. The large number of cases recorded during the past few weeks is associated with the surge in moderate or severely ill cases requiring advanced medical care. This fueled the social media promotion of the use of a number of new medicines, but unfortunately without also promoting or following the required safe and necessary processes of introducing, using, and monitoring new medicines. Let me take this opportunity to remind the public, us all our medical doctors and other healthcare workers, that all medicines, whether it's new, old medicine, whether it's routine medicine or investigational medicines, all of them must be registered with the Medicines Control Authority of Zimbabwe before they can be used or prescribed. At the beginning of the month, the Medicines Control Authority of Zimbabwe, in its Circular 5 of 2021, advised medical doctors and other healthcare workers against the unethical use of unapproved veterinary ivermectin for prevention of COVID-19 in humans. In a more recent communication this week, the Medicines Control Authority of Zimbabwe provided detailed guidance indicating that investigational medicines for COVID-19, such as ivermectin, that is the kind for humans, are to be used under controlled and structured environment in specific settings with strict monitoring to avoid that wanton and indiscriminate prescription and dispensing of such medicines. This approach is meant to protect the public, you and I, from unethical, unsafe doses and from counterfeited products, including veterinary ivermectin, for example. If you're going to get any drug, it has to be medicine approved for human use. The use of existing approved and registered medicines for a new medicine, which that particular medicine was not originally developed for, that is off-label approach is what it's also sometimes called, is an accepted approach at both global and local level, but in specific settings and under strict monitoring, follow-up, and so on. The key message here is that if you're using that medicine for a new disease, it has to be monitored very carefully, and you need to follow your patients very carefully. This is done to protect the patient. That drug has got to be registered as well. Medical doctors and all other healthcare workers in both public and private ones again are urged to use and prescribe safe and registered medicines as outlined in the Zimbabwe guidelines for the management of COVID-19. All healthcare workers are also urged to continue educating their patients on the importance of using safe and registered medicines at all times, whether this is being used in hospital or at home. The national response through the case management pillar has put in place very detailed and comprehensive guidelines on the management of all COVID-19 cases to be used at all levels. These guidelines, published by the National Medicines or Drugs and Therapeutic Policy Advisory Committee, reflect the consensus of local experts and take into consideration evidence-based therapeutics and practical evidence. COVID-19 treatment and other management recommendations in these guidelines are frequently updated based on scientific evidence, expert opinion, and additional guidance from the Medicines Control Authority of Zimbabwe. These guidelines also promote quality service to all patients and other healthcare recipients through the rational use of medicines and other therapeutics. The national guidelines summarize the management of patients based on COVID-19 disease severity, and these evidence-based guidelines are very similar to those used regionally and globally, and consist of the following two key elements. The first one is, and perhaps the most important one, how to prevent the infection. And this is what we've talked about here week in, week out. The second one is how to institute control and supportive measures that include use of registered and approved and effective medicines. Patients with mild COVID-19 symptoms and no known high-risk factors are instructed to self-isolate at home and to be in regular communication with their healthcare worker for additional guidance if symptoms get worse. And we've talked about this before. Recommended medicines for such patients are mostly over-the-counter medicines meant to relieve the COVID-19 symptoms. Safe home remedies such as lemon tea are also welcome. Early effective treatment of any disease can help avert progression to more serious illness, especially for patients at high risk of disease progression and severe illness. And of course, this also has the additional benefit of reducing the burden on healthcare systems. If we move on to the second category of patients, patients with moderate to severe COVID-19 symptoms. These are admitted and managed in hospitals where they receive supportive management by a team of qualified and registered health professionals under the guidance and supervision of a qualified and registered medical doctor. The supportive management for such cases can include supplemental oxygen and mechanical ventilatory support, as well as administration of approved and registered prescription medicines such as dexamethasone, anticoagulants, and antibiotics when these are indicated and in line with the national guidelines. The national guidelines provide very, very clear direction on how and when to use investigational medicines such as ivermectin. In the meantime, several clinical trials to assess the effectiveness of a number of new medicines for COVID-19 are ongoing globally and here in Zimbabwe. Government urges all healthcare workers, individuals, and communities at large not to promote or misleading information on COVID-19 medicines, as this has the potential to cause more harm than good. Finally, prevention is the best medicine. It is the best medicine. Let us adhere to all the recommended preventative measures in order to end this pandemic once and for all. I urge you to social distance, wash your hands with soap and running water, sanitize your hands with an alcohol-based sanitizer, and always, always wear a face mask properly. Your life depends on it. Thank you.